state officers, advisors, and national staff. We are honored this afternoon to have with us a very special guest. He is currently serving as our 37th Surgeon General of the Navy and is Chief of the Navy's Bureau of Medicine and Surgery. He received his bachelor's degree from Georgia Tech and his medical degree from the College of Medicine in Georgia in 1981. He has also served as the chief of numerous naval medical centers and clinics. National HOSA is honored to have Admiral Nathan from the Navy open our 7th annual Washington Leadership Academy.
Well, it's a pleasure to be here. I know you're special because I'm missing the second half of the Georgia Tech NC State game right now. Bethany, what do you root for in North Carolina? Yeah, it figures. You can wait outside, okay? So I'm really humbled to be here and to sort of give you some kickoff on what's going on. I have been involved in medicine, the education of medicine, the dynamic of the health sciences for many, many years. I happen to be now obviously a member of Navy medicine, and that was not my trajectory. When I was at your point in life, I had long hair, a beard, and I was not a poster child for the military. But life is what happens to you when you're making other plans. And some of you have a set goal of where you're going to go, and you may veer left or right, and others of you will head more towards the center of it. That's the interesting part about the journey that you're on. You've demonstrated an interest in health sciences, and God bless you for that. Our nation, our world needs it. We need to rejuvenate and continually replenish people who will be healthcare leaders, both individually in their communities, nationally and internationally, to make a difference. You know the old expression, to the world, you may be just one person, but to one person, you can be that world. Who will you be the world to? Who will you mean the world to? Who will you make a difference for? Will it be on the point-to-point intersection of an individual as you care for them as a nurse, as you provide support as a technician, as you care as a physician, as you provide as a dentist? Who will you make a difference for in the community or internationally? If I were to ask you what is the most deadly animal in the world, what would you say? The most deadly animal in the world. The mosquito. The mosquito. Malaria kills nearly 1 million people a year. We don't hear about it because we don't have malaria in this country. We do very rarely. But again, we're working on it. I'm proud of the fact that Navy research, and my Navy research labs exist. I have them in Peru, where they're working on dengue and malaria and encephalitis. I have a Navy lab in Cairo. Things are a little interesting in Cairo right now. You can get cheap airfare to Cairo right now. But they're hard at work looking at the vector-borne illnesses there. We have labs in Thailand, we have labs in Vietnam, we have labs across the country, and so we're trying to do emerging things to better the world. I think you'll visit on Monday. You're going to go out to USHUS, which is on the Walter Reed Bethesda campus. Walter Reed, which is the Army icon of care, which was merged with the Navy Medical Center. Walter Reed is named after Major Walter Reed, who back in the 1920s discovered the cause for yellow fever, which at that time was the scourge and was killing hosts of people in the Caribbean, in South America, and in the Gulf states. And he went down there and discovered that. Many of his crew who went down there died of yellow fever in the process of being in Cuba trying to figure out the root cause. And so because of his courage and his tenacity, just to show you how we can advance in some things and not in others, Major Walter Reed died as a fairly young man of appendicitis, because at that time we didn't have the way to diagnose it accurately. Which brings me to my next point. You're going to inherit a medical world regardless of what you choose to do. Regardless of what you choose to do. What aspect? you choose to enjoy, ranging from the technical, maybe in the laboratory, the pathology, the clinical lab, to dentistry, to medicine, to psychiatry, to emotional health, to wellness, to public health, to preventative medicine. You're going to inherit technology that is unprecedented. If I were to ask you, and I'm dealing with some pretty bright people here, what you think the first game changer was in medicine across the world that occurred. The first thing that happened in the history of medical practice, that all of a sudden people stopped dying in droves and started living in droves, what would you say? Penicillin, antibiotics, the germ theory, right? 2 points, West Virginia, okay? Once we understood vaccines, vaccination, antibiotics, people who came in with a diagnosis before that of simple lobar pneumonia, and I'm an internal medicine specialist, so that's the kind of things I treat, would have been a death sentence. And now with oral medications, you go on about your way. Okay, antibiotics, germ theory, infectious. What was the next big game changer in medicine? Well, vaccines, germ theory, understanding the transmission of viruses and bacteria. What was the next one, though, after that? That changed the practice of medicine as we know it. Anesthesia. Anesthesia. What school are you from? Okay, 5 points for your team. All right. Why anesthesia? Because all of a sudden you could operate at leisure. During the Civil War, do you know how you measured the worth of a surgeon in the Civil War? How fast they sawed. How fast they sawed. Because we took off lots of limbs in the Civil War because of the ball and musket firearms that when they hit would shatter things. And lots of people lost their legs and sometimes their arms. And you couldn't sleep them. You had to saw their limbs off. And that wasn't that long ago. Okay, anesthesia. Operate on the body at leisure. What's the next one? X-ray. Imaging. The ability to look inside the body without opening it. CT scans, MRIs, PET scans, metabolic scans. These are amazing. These are amazing. And now we're getting more and more interventional where we can replace heart valves by threading a catheter through an artery. So imaging, fluoroscopy, diagnosis. We're in the current one now. What's the current one? I'm sorry? Bioprinting. It's a cool way to make a model airplane, but and you can replicate using polymerases. You can replicate a lot of novel medicines by harnessing gene theory, but you're very close. Genetics, biogenetics. Okay? Diagnosing by using the gene mapping and treating by using customized Taylor concierge gene mapping. And if you don't believe that's dramatic, a woman goes in to the doctor, she has a family history of breast cancer. That's all we know. She has a family history of breast cancer. And she goes in and she gets a red top tube drawn out of her vein, a quick little blood draw. The results come back. And Angelina Jolie decides to have a prophylactic bilateral mastectomy based on her genetic predisposition and the statistical chance that she would develop breast cancer. That's how dramatic biogenetics are. And now we're tailoring tumor kill drugs biogenetically so that we can individualize the therapy of every individual patient. So that's where we are now. It's going to change the way you live, and the way you care for patients. I believe the next one, the next big game changer is going to be virtual medicine. It's going to be the ability to treat people remotely using sensors, using telemedicine, using digital radiography, using transmittable ultrasounds, using nanotechnology, which you can insert into the body and which will give you sensor readings and which will have targeted moieties that can go to one cell or another and deliver its thing. We're big on that in the Navy because I have a lot of ships that are out at sea all the time, and there's no way to get a full-time medical staff to all of those. So the doctors that have limited care there need virtual care so that I can diagnose heart attacks or ulcers or seizures or those kinds of things from afar. And we're working very hard at that in the Navy to do that. And that's going to be both an opportunity for you all as you inherit the watch in medicine, as well as your challenge. And what do I mean by your challenge? We're getting farther and farther into technology, and that causes, to some extent, us getting farther and farther away from the patient. Remote medicine is good. What a difference it can mean if we can treat somebody in Juneau, Alaska, or somebody in South America, or a young child in Africa, remotely. That's wonderful. But we can't rely completely on technology because this is a human profession. Your goal should not be to become part of a job or to pursue a vocation. Your job should be whatever aspect of healthcare you choose to go into, to pursue a calling, to be part of a profession. And that involves, in my opinion, always the human-to-human interface. And we tend to drive you farther away from that now as we get more technology, which is a good thing, but as we also reduce your exposure to patients. And I think that whatever capacity you serve in, we can't afford to lose that. And as you grow and cultivate into the next leaders in healthcare, in whatever role, I think it's going to be important that you maintain that. I still teach. I've taught all my life. I've been on faculties at various University of California, here in D.C., and I've come to realize over the years that we can't always be the cure. We can't always be the savior. We can be there. And ladies and gentlemen, whether it's a Marine who lays dying on the battlefield, or whether it's a woman or a gentleman in their 80s who's passing on and their family surrounds them at the bedside and is saying goodbye, and you're at the bedside and you squeeze their hand, or you're on the battlefield and you squeeze his hand, and they squeeze back. They're not squeezing back to say, I'm still alive. They're squeezing back to say, don't let me take this journey alone. Be here with me. Be there for me. And I think if you keep that as your true north on your compass, when you couple that with your obvious academic talent, your obvious passion, and your obvious curiosity, and your desire to make the world a better place, you'll be superb. Because there'll be a point when you'll be caring for me or my family. And I'll certainly want you to be there. When I lecture medical students and I talk to house staff, I talk to them about the 3 A's, and they're in this order: affability, availability, ability. And they say, well, Dr. Nathan, you listed ability third. Wouldn't you want ability to be the most important thing? And my answer is, our patients assume that we're able, or they wouldn't allow us to practice. They wouldn't allow us to treat. They wouldn't allow us to be present to generate health care. There is no greater responsibility than simply taking a piece of paper, or now in more modern times entering it on a computer, an order that injects something that potentially kills somebody into their body. It is an awesome, awesome responsibility. I remember one time when I was training and we had a patient. This was many, many years ago. I was a resident and we were training. I was practicing in the hospital as a resident, and we had a patient who had come in who was, and unfortunately this is a sign of the times with current events, we had a patient who came in who was very distraught, and he'd brought a handgun with him, and he was at one end of the ward, and he was shooting into the wall, fortunately. Not shooting at people, but shooting into the ceiling. We were all huddled at the other end of the ward. And the nurses are all huddled down, and we're all huddled down, and I remember my buddy, who was one of the surgery residents, reaches up to the chart rack and grabs the chart, brings it down, writes a note on it, and hands it to the nurse. And the nurse opens it up, and it says, "Take gun away from patient stat." There are some orders that nurses are not required to carry out, and that was one of them. And that brings me to the partnerships that are occurring now more and more. It's much more of a collaborative team between the physician, the nurse, the nutritionist, the pharmacist, the physical therapist, the optometrist, the allied health specialist, the chiropractor. It's much more of a collaborative approach now. And that teamwork is paying big dividends, because when you put your heads together, when you put your egos on the back bench, and you put your passion for taking care of the patient first, that's what counts. So ability is critical, but our patients assume it's there. So they measure you by your affability, how much you respect them, how much you treat them as an individual, how much you are there for them. And then after that, they measure you by how available you are to them and how easy you are to access. So those are the hallmarks of, I think, being a care provider in any capacity, be it in the laboratory, in research, in an x-ray reading room, or on the front lines as a surgeon or as a critical care nurse. My aide, Mark Thomas, over there, is just recently finished his fellowship at Duke in critical care nursing. And so we're blessed to have a wide variety of people from all walks of life that can do things in the Navy. One of the things that I've always been concerned about and that I really don't like are people who drop names. I don't like name droppers. I was talking with President Obama not long ago, and he was visiting wounded warriors with me at Bethesda Walter Reed. And we were talking about what makes our healthcare system in the federal sector different than the private sector. I trained in the private sector. I did not train in the military, so I'm a little bit of an anomaly. And I still maintain very close ties with my civilian friends who are in private practice and very good ethical physicians, hardworking. But the main change is that we're still a primary care-centric organization in the federal healthcare sector, and we have a basically insured population. You're going to inherit a planet, a country, that's going to have anywhere between 70 to 75 million people who are uninsured. And you're going to have to figure out how to access that. And boy, if you don't believe that's controversial, just read the front page today over healthcare reform and what the right answer is. And a lot of people disagree with the president, agree with the president. I can't do either one in my position other than to certainly second his concern that if we don't get our arms around healthcare in this country, it's going to erode our GDP, and it's going to erode our national security if we don't figure out how to remove the haves and the have-nots from healthcare in this country. So I make the pitch to you that you have the opportunity, given your zeal, your passion, and the effort, and the considerable time and effort it took you to get here. Obviously, you've culled yourself from the herd as being somebody who wants to lead rather than be led, as somebody who wants to make a difference and contribute in life rather than being left behind, as somebody who wants to step out in front and change things for the better. I don't know who that's going to be for. Out there, ladies and gentlemen, somewhere 3, 5, 10 years from now is a family, an individual, somebody who you don't know, they don't know you, and you're going to irrevocably change their life, ideally for the better. They will owe you a debt of gratitude, and they will thank you, and they will talk about you to their family. And they may never know you. It may be because you cultivate a cure for a disease, or you simply are at the bedside easing their pain. Either way. I'll finish by showing you a quick video because I always like to show people some things they don't really know what's going on. And you're all here for leadership, so I'm going to give you a leadership tip. Here it is. So you're a country like Haiti, and you're going along, you're not doing real well in the first place. And all of a sudden, an earthquake comes and it just crushes you. Just crushes you. And your first problem is your people are crushed. They're going to be, but they're not yet infected with dysentery or waterborne illnesses or dehydration. They're crushed, and they need surgery. They need trauma care. The problem is the hospitals are crushed. So the president called the chairman of the Joint Chiefs of Staff, Mike Mullen, Navy Admiral. He said, I got just the ticket. We've got a hospital ship in Baltimore, Navy hospital ship. We have 2, one on each coast. I'll get it down there. I'll get it going in 2 days. So he called the Chief of Naval Operations, He said, 2 days, got it. He called the Surgeon General, who was my predecessor at the time. He said, 2 days, got it. Surgeon General called me. This is before I took over his job. Surgeon General called me and said, you got 2 days. I said, holy guacamole, 2 days? I got to get 500 people in 2 days on that ship, and I've got to just tell them all of a sudden they got to go, and I don't know when they're coming back. He goes, that's right, you got 2 days. And I said, you got to help me out. And he said, you got 2 days. So here's my leadership tip. So I called all my directors together, and I said, I got bad news. We got to do this in 1 day. And they said, sir, holy guacamole, 1 day? Impossible. We can't do it in 1 day. I said, all right, I'll try to get you more, but it'll probably be my job. And I called him back. I go, I got you the second day. So I was a hero. And they made me Surgeon General. But I just want to show you, because I don't think some people understand the magnitude and the dimension of some of what we do as we work. My job in the Navy is to basically support the warfighter, but it's a global force for good. And although we build our Navy for war, we operate it for peace. Our goal is to be there, out and about. Compared to the other services, we're always out and about, so we can make a difference. And when Haiti went down, when Indonesia went down, when Tomodachi went down, when various insurrections go down, we're usually the first ones on the scene. In this case, it was completely for a humanitarian assistance mission, which is really our coolest missions. So let's see if we can fire this up, and we'll just show you a few minutes of the comfort going to Haiti.
I know I'm not going to be able to treat everybody for everything. I just knew I had to give everything I had to everybody who was on the ship.
We're going to go to our neighbors around the world and show them that we have compassion.
We take care of people who have so little.
You can put this ship off the coast anywhere, and it is a symbol of we're here to help. We're also here to learn as much from your country as you can from us.
If you were to take John Hopkins or Walter Reed and put it inside the skin of a ship, that's what we have.
We have digital x-ray, we have dental, we have optometry.
We have a CAT scan machine.
12 operating rooms, as well as an interventional radiology suite.
We have our own oxygen plant that produces medical oxygen. 80
ICU beds and hundreds of ward beds.
So anything you could do at a Navy or civilian hospital, we can do it here. The only difference is we can come to you instead of you having to come to us.
Operation Continuing Promise is actually a regular deployment schedule where we take the USNS Comfort to Central and South America. The countries vary a little bit.
We work with the ministries of health to be able to build a partnership of caring, a partnership of learning and education.
We made a promise to these countries that we visited that in any time that they're going to have a need for us to come down and help them, that we would be back.
I was driving home from work, and as I was driving, I started hearing about the earthquake.
And I told my wife, I said, well, I've got to get my sea bag ready because I'm going to be getting a phone call tomorrow. We're going to go down to Haiti probably by the end of the week.
I really felt that this is what I've been preparing my entire life for.
For Operation Unified Response, the ship was underway in 76 hours.
On the way down to Haiti, we kept receiving a lot of information via email about hundreds, thousands, tens of thousands of people, primarily with orthopedic injuries. But it's one thing to see a couple of pictures on the internet, another thing to know that you're actually going to be a part of the human element of what we see, the devastation. The fact that that suffering was going to be coming on board in numbers that we had no idea of how many or for how long.
When we're about 100 miles out, we started getting patients. We went nonstop the first 3 days.
About every 90 seconds, those elevator doors open, and here come more and more patients, and they just kept coming. Then there would be about a 20-minute delay, the next round of helicopters, and there would be more and more coming.
Anywhere from newborns that didn't have any family left up to, senior citizens.
So it was kind of like a mayhem, because you've got two different cultures, you've got different types of understanding of the disease process.
So each and every patient that would come in, I would spend some time with an interpreter to understand their story, because the next one seemed to be worse than the previous one. You couldn't make this stuff up. We had an individual who was approximately 28 years old, and he had a very bad injury right over his elbow on his dominant arm. Basically, it took out the joint itself. Now, the interesting thing with him was this part worked just fine. So he knew that he was probably going to have an amputation. But in talking to him, he has a family, he has dreams for his kids. So I was with my colleague, a hand surgeon, Dr. Rulin, and we looked and we saw that he may not have an elbow, but what about if we just connect the bones up? If we can get the bones to heal, he won't have any motion across the elbow, or what was the elbow, but he'll still have the use of his hand. We took him back after the surgery into the recovery room. The first thing he did when he woke up is he kind of looked down to see if he had a hand. He saw his hand, he grabbed it just like he did before, picked it up. It works, it works.
I think in the big picture, the big scheme of things, having the comfort and the mercy shows the rest of the world that we're not just out there to go, drop bombs in the desert and fight wars. We can project a positive image and soft power on the rest of the country, rest of the world, and maybe change some people's opinions about us.
We are military, but we're in a big white ship. As a matter of fact, many places we go, when they see us off the coast, they call us the Great White Angel from America. Every site, hundreds and hundreds of surgeries, lives that are changed, and impressions that are altered for the benefit of the United States of America and our partner and host nations as well.
From a humanitarian assistance perspective, there's not anything more rewarding that you can do truly in the Navy.
One of the testaments to our people is that I was worried with such short notice I wouldn't have the whole crew assembled in time, that people would sort of duck out on the mission. And as we were getting ready, saying goodbye to everybody as they're going up what we call the gangplank or the brow of the ship, I had stowaways. I had people who I know who weren't supposed to be on the mission going up. And I said, Smitty, you're not on this. Sir, please let me go. We had people fly out from our naval hospitals in San Diego at their own expense and try to sneak on the ship to try to do these missions. They're that enticing because we really like being that part of the American taxpayer dollar, making this kind of difference around the world. So I'll simply close by saying there's a whole gamut of things. The nice thing for you is the range of opportunities you have to make a difference, be it as a physician, a nurse, a dentist, a technician, allied health, emotional health, spiritual counseling. I'll simply repeat again, I thank you on behalf of that child, mother, father, grandfather who has not met you. But because you've taken the steps to get here, and this is one of the lights you have to pass through, you have to go through a series of lights, stoplights, in your journey and your road path to your milestone. Because you've made it this far, you'll keep going, and they'll be that much the better for it. You will have made a difference. And when your time comes, and hopefully that's a long, long time from now, and you all will discover the elixir for youth, but when that time comes, you'll be able to turn to somebody and say, I made a difference. I think you're doing that today. I'm sure you do that tomorrow. And I thank you on behalf of not just the country anymore, because it's a global world, on behalf of the world for the difference you're going to make. Congratulations on getting here. I'm proud to be among you. Thank you.